guys, in this lesson we are going to be talking about the diagnosis cerebral palsy. Most of the time we refer to it as CP, and CP is actually the most common cause of developmental disability in kids. It's a static disorder, which just means that it doesn't progress or get worse over time. And so medical care of CP is really just all about optimizing function and minimizing complications for these kids. So let's get started looking at how we do that. So let's just make sure we have a really solid understanding of what actually causes CP and then how it affects these kids. So the actual specific cause can really be almost anything that causes injury to the brain. So this could be happening prenatally, it could happen during delivery, it could happen after birth. And a lot of times it's something like trauma, a bleed, or an infection. But the most common cause is actually anoxia, which just means that for some reason or another, the brain went without oxygen for a certain amount of time, and then the brain became damaged. When this damage occurs, the location of that damage actually impacts how it's going to present for that child. But generally, what it's going to do is it affects the child's movement, their coordination, and their posturing, and that's what our assessment really focuses on. There are 4 different types of cerebral palsy, and they are spastic, dyskinetic, and ataxic, and then the last type there is mixed, and that just means it's a combination of the 3 before. Spastic CP causes stiff muscles and contractures, and it's actually the most common type of CP, and the part of the brain that's damaged is the cerebral cortex, which you can see circled here in blue. Dyskinetic CP causes uncontrolled movements, so you get things like tremors and movements that patients can't control on their own, and the part of the brain that is affected is called the basal ganglia, and that's right here sort of in the middle of the brain. Ataxic CP causes poor balance and poor coordination, and it's actually the cerebellum that's damaged. Other terms that are often used to describe CP are hemiplegia, so half of the body, either the right or the left, is affected. Diplegia, which means either the upper half of the body or the lower half of the body is affected. And then you have quadriplegia, where that would mean that all 4 extremities have been affected. Monoplegia means that only one limb has been affected by the damage. So for example, a child who has spasticity in one arm would then be diagnosed with spastic monoplegia cerebral palsy. Now, cerebral palsy isn't usually evident at birth. It actually presents over time within that first year of life. And usually what's noticed is that there's a general delay in their motor development. In other lessons, we've talked about how important it is to be patient with your assessment in kids. Specifically, I've talked about how important it is to take your time with your respiratory assessment so that you can get the full clinical picture. Well, I would say the same is true for a child's neurological and musculoskeletal assessment. Really take time to watch that child move and play in their normal environment. Now, the things that we're looking for with CP are abnormal movements, abnormal posturing, abnormal muscle tone, and abnormal reflexes. So let's talk a little bit more about what we mean for that. So with abnormal movements, things that we're looking for are persistent tongue thrusting. These things are involuntary for them, so they may be writhing or even have jerking movements that they are not controlling. Examples of abnormal posturing are when they have spasticity maybe in a hand or foot, and you can actually see in the photo here what spasticity can look like. Other things that we see with abnormal posturing is that in infancy, you may actually see the baby do something that's called scissoring of the legs. And this indicates that they have increased tone. So the legs are extended and they're sort of crossing over one another. Or they may have something that looks like frog legs, which just indicates that the child has decreased tone and the legs are kind of floppy and then open at the hips. Another big sign that there's something wrong with posturing is if a child has a preference for one hand or the other before they are 1 year of age. We should not see any signs that a child is left-handed or right-handed before they are 1 year old. For abnormal tone, you're looking for signs of decreased tone or increased tone. And we've just talked about 2 of those, which are the scissoring and the frog legs. But another example would be just sort of a baby that has generally poor tone. So sometimes we use the term floppy baby, which just means maybe they have poor head control and poor neck control. And when you're holding them, you can just feel that. And examples of increased tone in babies are maybe a baby who's frequently arching its back when you're holding them. Kids who have cerebral palsy, their reflexes are usually going to be hyper, so they're very exaggerated. And a lot of times their newborn reflexes are going to persist beyond the normal time. So normally newborn reflexes are present only up until 6 months of age, but a kid who has cerebral palsy, those may actually persist beyond that 6-month age range. Now, like I said, most of these are going to present in that first year of life as some sort of abnormal motor development. So if you need a refresher on what is considered normal or how you might do a developmental assessment on an infant, check out the infant growth and development lesson because it's going to give you all of that information. So as I said, CP is a static problem. The damage to the brain is not going to be getting any better or any worse over time. But these kids do experience a lot of fluctuations in their health and wellness because there are a lot of problems that come alongside these issues of movement and tone and coordination. So they may end up actually needing a lot of surgeries and hospitalizations. And so I just really quickly want to make you aware of some of the diagnoses and issues that are often associated with kids who have cerebral palsy. So one thing to know is that learning disabilities and decreased cognitive function, that actually occurs in about 30 to 50% of patients who have cerebral palsy. And many children with CP will actually also have seizure disorders or epilepsy. They're going to have vision and hearing problems, gastroesophageal reflux, which can lead to aspiration and chronic respiratory infections, and also can cause poor dental health as well. They're at risk for having constipation. That constipation could be because they have decreased mobility or a poor diet, or even because of the seizure medications that they're taking. And then failure to thrive is really common as well. These kids can have a difficult time because of their poor tone, taking in the amount of calories that they need, so we can see some weight loss. And then they also get contractures and can have chronic pain from that. So I just want to give you some really quick examples of ways that you might come into contact with these kids as a nurse. So first example, they might be having those seizure medications, but all of a sudden it isn't working. They're growing and they need to have their medication doses changed and they're having seizures again. So they come in to kind of have that adapted. Or like I said, their seizure medication may be making them constipated and they have an impaction, so they have to come into hospital to have that cleared out. Another example is that maybe they've come into hospital for a G-tube placement because they keep losing weight, or we see them quite often, again, for orthopedic surgeries to help with contractures and other MSK problems. So you can kind of imagine now that our therapeutic management of CP is going to be very patient specific, and it's totally going to depend on the severity of the disability and then what other diagnoses they have. But always, always, always a multidisciplinary approach is going to be the best way to make sure that all of these issues are being addressed. PT, OT, and speech and language therapists are really important players in all of this to help kids reach their full potential. And like I said, the goal is to maximize mobility and communication. We want these kids to be as independent as possible and minimize the amount of time that they are in hospital. So these kids can be on a lot of medications, but I've just listed some of the common ones here for you. So you have Valium, baclofen, and botulinum injections, which is essentially Botox, are going to be used to help with those muscle spasms and contractures that can be really, really painful. They are also likely to be taking anti-seizure medications, reflux medications, and then laxatives to help prevent the constipation that can be so problematic. Now, I just want to say really quickly, from a nursing point of view, there can be a lot going on with these patients, a lot of medications, a lot of equipment, and a lot of diagnosis. And the thing is that they live with this all of the time. They have a routine, they know what they want and when they want it and how they want it to be done. So my best piece of advice is to straight away talk to the family and find out their preferences, and then pass those preferences on to the other nurses that are going to be taking care of them. And this is just going to make life easier for everyone, and it keeps the families from feeling like they are constantly repeating themselves. Your priority nursing concepts for a pediatric patient who has cerebral palsy are functional ability, mobility, and human development. All right, so let's recap your major learning points for this lesson. So first thing, cerebral palsy is a physical disability that is caused by brain injury that affects movement, coordination, and posture. Now, in your assessment, you really, really want to pay close attention to how the child is moving and how they're playing. You want to look for spastic or flaccid muscles, or if there's any change to gait or how they're crawling, or if there are any abnormal movements like writhing or jerking. Remember, all of this usually presents in the first year of life as some sort of developmental delay that's either caused by that poor tone or an increased tone. So make sure that you refresh on infant development. It's really important to be aware of other diagnoses that are associated with cerebral palsy because they can complicate things for their care. So the things you want to be aware of are learning disabilities, gastroesophageal reflux, constipation, epilepsy, and then vision and hearing problems as well. Our management and treatment is always going to be approached from a multidisciplinary point of view with the goal of maximizing this child's function. PT, OT, and speech therapists are a huge part of this process. Medications that you need to be aware of for this patient group that are going to help with spasticity and pain are Valium, baclofen, and the botulinum. Okay, you guys, that wraps it up for our lesson on cerebral palsy. Make sure you check out all the resources attached to this lesson. Now go out and be your very best self today, and as always, happy nursing.